Welcome to Amazing Interviews. My special guest today is Professor Jean-Claude Deharo. You are from Marseille, so you are the leader in the field of electrophysiology, and you are working in Hôpital Timon. So it's a very interesting name, and also it's similar with my language. We understood exactly because our connection, Latin languages are feeling like that. Welcome here, Jean-Claude. It's a privilege to have you here.
Thank you very much, Dan. I'm very happy to be here with you. This is the 64 annual meeting of your Society of Cardiology, and I'm very honored and very proud to be with you. Well, to introduce myself a little bit, I work in Marseille, as you told. Marseille is the second town in France in terms of number of inhabitants. I work in a huge university hospital. You know this hospital.
But even in Paris, they are singing as an anthem Marseillaise.
Yes, so could be. We believe we are the first city in France, but we are the second one. Anyway, we work in a big hospital with adults and also with children. And as you told, my specialty is about electrophysiology, meaning that we do, of course, all which can be done in this field. I am a specialist in electrophysiology, and I have particular interest in syncope, as you mentioned, because my invitation for the meeting is on syncope. I also perform some lead extractions, which is a job which has became
very
important.
Difficult,
yes,
very important.
Important because our patients.
I know from Dragos Kozma, my colleague in Timisoara, about that.
This is exactly what we did with Dragos a couple of years ago, and also, of course, ablation, atrial fibrillation ablation, but all kind of ablations. So my pleasure is to be here with you.
Many of my colleagues were trained there, and I'm very happy to have you here for this discussion because you are a very, very famous cardiologist. So please share with us, are there specific ingredients for becoming famous or for the celebrity?
Well, not sure I'm really famous, but anyway, I can give some counseling. I would say that the important thing is really to start learning. This is very important. This is what I tell to students. It's not exactly students we are talking with, but starting learning all we can learn, because this is very, very, very important. And this is all because it gives you, of course, a background, but also it gives you idea. Otherwise, if you don't read what people did before, you never know what to do. So starting learning what was performed before. Also being really, I would say, interested by all the things in the field. It means that it's really a 24-hour job being in this field, wanting to meet for celebrities, wanting to meet also for colleagues, having discussion with everybody. This is very, very important. And this generates idea.
Interaction.
Yes, interaction.
Yes, electrophysiology is your passion. Medicine is also your passion, but also the broad spectrum of social network.
Exactly, exactly. And I think that we cannot go forward without interaction, of course. This is
isolation is not good.
Isolation is not good. And in our work, it's very important to interact, because I need to get ideas from you, Dan. I need to exchange with you, to tell you what we do, and you tell me, yes, okay, but we did it and we changed, or we will do it in the future. This is very interesting. This is exactly, I think this is the most important thing. And the good thing in our job is that we can do it all our life.
Yes.
We start learning, and we learn every day from our colleagues. And this is very, very interesting. Making a job like really a hobby, more than a job. It's a hobby.
Wonderful answers. You told already about exercise the brain and the soul, but also I'm looking also to your daily program, because for sure you have a good balance between rest and activity. Is it possible to share with us how it looks a perfect working day for you, about the meals, about doing things like that? Can you describe this?
It's a very important question, because I think that we have to do a long way. And for doing a long way, hopefully, we have to really be healthy. And it is very important to have a good balance between everything. Well, in the morning, the important time is discussion with colleagues. And at that time, we also drink a coffee, we discuss, we take, we don't look at the clock for, let's say, 1 hour. This is our morning meeting. But we have the discussion
So you
we
are
need to
starting
have.
early,
Yes,
waking up in the morning?
waking up in the morning early, which is not very good, I know. It's
No,
about,
no, it's good for all of us because we have to start early.
we have to start early.
6, 7?
Yes,
Yes.
even yes, 6 is good.
6 is good.
my time.
Go into the hospital.
Yes, I go to the
Inter-
hospital very early because I am responsible for the department.
Yes.
So I like to have 1 hour without the phone. And between 7:30 and,
Wonderful.
8:30, you are really, you can work and the phone is not
Eating in
there.
the morning or only coffee? A
Coffee,
croissant?
coffee and something sweet,
Something
which is
sweet.
surprising because,
Yeah, yeah.
because many people now,
No, no.
this is how I was, how I did
Exactly
from the very
like I'm
beginning
doing.
of my life. Yes, yes. A small coffee, a small croissant, not too much, and then I go working.
What about the lunch
The lunch.
in the hospital?
I have to tell you that I don't take a lunch every day, which is not very, very good. For example, when I have
Probably it's not so bad because your body weight is perfect.
yes, but perfect. I'm not sure. To be honest, I would like to have 1 hour of lunch, which would be
Okay.
good also because I think professional lunch is important because you eat, of course,
Yes.
but you also discuss with colleagues, you exchange, you have some interactions. This is not possible for many days because when I am in the lab, of course, I can stop for lunch. And when I have my outpatient clinic, sometimes I have also to give some lectures to the university, to the, as you do too. So it's a bit difficult. So I would say that lunch is not
It's optional.
something, it's optional. But what is not optional is my wife. My wife prepares for me something to eat for every day. Yes, she
Extraordinary.
tells me you will eat it, and
So
so sometimes
you're
it's
coming in the morning with
yes,
this package. Brilliant.
yes, and so I remember that I have a wife, which is important because I don't see my wife all day, and I remember it during the.
But what about the dinner?
And the dinner? The dinner is a standard French dinner, meaning that it depends what we will. Actually, I don't drink alcohol every day, so it's a normal dinner.
Good.
I drink alcohol once a week or something like this when I am with people, but not every day. And I don't like eating things with a lot of oil or this kind of thing. So my wife prepares normal things.
How many hours sleeping per night?
I would say that I sleep early. I go to bed at something like 11, something like this. I read a little bit,
So
and then
6, 7 hours for
yes,
sure.
6, 7 hours.
This is very
This
good.
is good. I like
Very good.
because
I'm a
know,
prevention
I know
guy.
that sleeping is becoming a
average.
very important part of our health.
I can share with you because I had many answers, but now I will tell you after that the average. You are perfectly shaped.
Okay.
Wonderful. Thank you so much. We have this part of the world, eastern part of Europe, but we try to say to our young cardiologist fellow that it's important to go in the direction to use the Western model to learn every day. Do you have a special message for our young cardiologists about how they have to do or to learn?
I think they should try to have interactions with their colleagues in the country, and when they don't find exactly what they want to find, which is unlikely but may happen, they have to go elsewhere to find it. So I think it's very important to have like a path in front of them. They start doing it here because I'm sure that it's very well done. In your country, it's always easier to do. And then when they need some subspecialty, they can go to another department. And as you told, I had many fellows coming from Romania. I was really impressed by their capacity of adaptation. In a few days, first of all, they were speaking French very well. They were writing French very well, and they were doing exactly what we do. So I would not really tell that the Western model is different from yours. The Western model is the same. You just have to adapt and take the good thing to.
In fact, we are living in the same country. European Union is also Marseille or Paris.
It's the
or
same.
Bucharest or Timișoara. So
Yes.
we're living in the same environment.
Fully agree. Fully agree. And I don't think that really even is more west or something like this. Even is where you find what you are looking for, and in our job you are looking for the excellence, I would say. So really always go where you can find excellence. Sometimes you can find it here, just a few meters from your office. Sometimes you have to go to another, and then you have to adapt. Very important to adapt.
Yes.
Because if you, but you know it, of course, if you arrive somewhere and you stay as you were a few days ago, no, if you arrive somewhere, you have to change. You
To
have to
make a
adapt.
step
Yes.
further and to enter in the
Exactly.
field.
Exactly.
You have to be player. You are cardiologist. You have
Yes,
to do like
yes,
that.
and really to get the better of what you are going to get.
Thank you so much for this. And at the end of our short talk, please allow me to put 3 questions from the long list of James Lipton, who interviewed celebrities in Hollywood. We are cardiologists and we are celebrities. So, first of all, what profession other than your own would you like to attempt?
Well, when I was young, I wanted to be a teacher. A teacher, but I mean a teacher in
Yes.
school.
Anyway.
Yes.
Yes, in a school, but
In
you
a
are now
school,
in
I am a
university.
teacher, so but I am a medical teacher, which is something new. I would like to really being a teacher for young children would be something I like. Yes, I really love give transmission to the young, to the very and when I am with my grand daughter and grand boys, I'm very happy to transmit. So I think this is another job I would have liked to do.
On the other hand, what profession would you not like to do? Is it something you
Yes,
dislike?
there are many. I think there are many because just because we don't know every profession. I'm sure that when we know a profession, but being a politician would probably not be interesting for me.
Probably it's about the truth and the lie and the
Exactly.
balance of these
Exactly.
things. And it's not about how to say a lie, but also to look in the face and say, that's the truth.
Exactly. And always looking for something you know you will never get. You will always have to accept a compromise. And sometimes I don't like compromise. I like
So happily, we are not involved in this.
no, no, this is good.
So, and the last is, if heaven exists and we consider that being doctors, we are believers. What would you like to hear God say when you arrive at the pearly gates?
You know, we are doctors. What we like is that really diseases would disappear. So I would like to hear that disease would disappear in a few days or
Amazing.
weeks. I accept
Wonderful
weeks. I
message.
accept
Wonderful
weeks.
message.
Yes.
So you are not asking for yourself, but for entire
Oh,
world.
yes,
So
yes. I would not.
that's the clear
I would
message.
really be happy to see people not suffering. Diseases, other things, but diseases because this is our job. And sometimes, you know, it's really hard for us to see somebody and to see that there is no solution for
Both of us are dreaming not to have the disease, despite of the fact that probably we are losing our job after that. But we will reinvent it ourselves.
Yes, we will do another thing.
Thank you so much, Jean-Claude. It's a pleasure to discuss with you. So we are waiting for you every time you want to come, and we are spending this wonderful discussion.
Thank you very much. I'm very happy to be here. I was like frequently in Romania when I come. I'm surprised by young people. I see there are many young doctors, and this is very good for a meeting. It means that you are really transmitting. You are in the right direction.
Merci
Thank you.
beaucoup, Jean-Claude.
Merci.
beaucoup.
Merci.